Good morning, everyone. Today, the topic of my presentation is to assess the awareness and knowledge about glaucoma in patients attending OPD of a tertiary care hospital. Glaucoma is a leading cause of vision-related morbidity. Glaucoma is the leading cause of vision-related morbidity worldwide and the second leading cause of blindness in the world, accounting for up to 8% of total blindness. In India, glaucoma is the leading cause of irreversible blindness with at least 12 million affected people and nearly 1.2 million people blind from the disease. Glaucoma is an optic neuropathy of multi-factor etiology wherein intraocular pressure is the most important and only modifiable risk factor. It usually has no symptoms and the vision stays normal in its early stages. As the optic nerve damage starts, peripheral vision is lost progressively till only the central vision is left, resulting in tunnel vision, total optic nerve atrophy and reversible blindness. There's no cure for glaucoma, but early diagnosis followed by early treatment can often stop or minimize the damage and protect the vision. Early manifest glaucoma trial, it was seen that patients with early and newly diagnosed glaucoma had reduced and delayed glaucoma progression over 6 years from 62% in the untreated group to 45% in the treated group. Alongside health education and preventive eye care can help in detecting glaucoma early. Now, aims and objectives to assess the awareness and knowledge about glaucoma in patients coming to the ophthalmology OPD of a tertiary care hospital. Materials and methods. This cross-section study was conducted in the Department of Ophthalmology of a tertiary care hospital. Total 205 subjects. Inclusion criteria, adult patient in the age group of 18 and above. Exclusion criteria, patients who were already clinically diagnosed with glaucoma, patients on any topical anti-glaucoma drugs, patients with predisposing conditions like trauma to the eyeball, uveitis, developmental glaucoma or optic nerve damage. Questionnaire translated to the patient's knowledge was given to all the patients. It included 3 sections. First, demographic data of the patient. Second section, patient's awareness and knowledge about glaucoma. Third section, source of information and if the patient underwent any ocular screening or eye checkup in the past 1 year. The questionnaire was adopted from a similar study done on awareness of glaucoma among residents of North India. The second section pertained to the patient's awareness and knowledge about glaucoma through 10 questions. The initial 4 questions evaluated their awareness and the next 6 questions were used to assess their knowledge of glaucoma. Results. The questionnaire was administered to a total of 205 patients and their answers were analyzed, of which 109 subjects were males and 96 were females. The mean age group of the patients was 49 years. There were statistically significant differences between different age groups and their awareness of glaucoma, yet only 33.9% had accurate knowledge of the disease. Now this is the pie chart which shows the source of information from which patients are getting the awareness of glaucoma. First is hospital, ICAP and health personnel. This is the main important source of information. Second is TV, radio, newspaper, and third one is family, friends, and relative. Now this bar graph shows the knowledge and awareness of study subjects who had heard the term glaucoma at the time of the study based on the specific questions asked about glaucoma. Some patients think that cataract and glaucoma is the same. Risk of glaucoma increases with age, anyone can have glaucoma. These were the questions. Conclusions from the study, it was concluded that there needs to be a strategic plan to increase the knowledge and awareness of the disease, its prognosis and its management. Since glaucoma usually presents with no symptoms and warning signs until it's too late, spreading awareness and knowledge about the disease is critically important. The emphasis needs to be on the early diagnosis of the disease process, thereby initiating timely management to limit its progression. Thank you.
What was the education status of these patients?
So we have taken everyone, like illiterate and literate also. Like patients who have gone to the hospitals for screening, ocular screening, and patients who doesn't know what is glaucoma, both. Like some patients think that glaucoma, like chitta motia, glaucoma and cataract is the same. So we have taken all the patients.
And you showed, I think in somewhere you had written that there was age difference also.
Yes, sir. Like we have taken, sir, people above 18 years, but in different age groups, sir, there was differences were there. It's not statistically significant that different.
Which age group had the maximum awareness?
Sir,
you didn't show that.
50, sir, 49 age.
50 and above.
Yes, sir.
Okay.
How do you make sure your patients are well aware of glaucoma? Do you conduct any lectures routinely in the department for the patients and their relatives to make them aware about glaucoma?
Sir.
Because about 41% maximum awareness was from the hospital. Just show that slide. Yeah. 41% was from hospital, ICAP and health personnel. So how did this happen? Was some awareness program, some lectures were conducted by health personnel?
Yes.
Can you elaborate on this 41%?
Yes, sir. So like in eye camps, like in CMC, we conduct the eye camps, like for screening of different disease. Like their patients are coming and we are checking like they have intraocular pressure is high or something is there. So we tell them that about glaucoma, this is the things by that.
Okay.
Thank you, sir.
So do you really get time during the eye camps to make patients aware? I'm sure CMC eye camps are very busy. But what about the relatives? Do you conduct any lectures for the relatives to make them aware about this disease?
Sir, can you, sir, pardon, sir, I didn't-
Some lectures, some public awareness lectures are conducted on glaucoma regularly or during this thing, glaucoma week.
Yes, sir.
When is the glaucoma week?
Sir, like